process the tissue in a manner that helps us essentially extract the most value out of the bone marrow and the cells and tissue. And we're able to separate this and actually process here in a sterile hood environment. If you step back, you can actually see what I'm talking about here. This creates a laminar airflow and is essentially what is done to produce, for example, if you're in a hospital and you're prepping things for patient use, this is what we would use. This is atypical. We're the only lab in the state of Oklahoma that actually even has a lab like this that allows us to process this in the safest manner. A couple of other key things. We've already measured the patient's blood counts, so we know from that factor, we're aware of what his platelet count is, what his hemoglobin is. In addition, we'll actually measure the cell content. So what is the concentration of cells per cc of fluid that we're pulling? And then as we concentrate that and prep it, at the end, we'll test what we call cell viability. So we know how many of those cells are actually alive, because merely by processing the cells and taking them out of the body, you're gonna lose a small percentage. With our technique, we have one of the highest percentages of cell viability, we call it, being performed in regenerative medicine. No machine really can compete with our cell viability numbers. We routinely exceed 92% cell viability at the end of processing, which is fantastic. So that means 92% of the bone marrow, which contains stem cells, is actually going to be viable and be ready to do the job we're trying to get it to do for that joint or that tissue as we inject it. So this is basically a complete setup and for shoulder procedure, and then just going through things. We've got lipid layer, we've got 7x SCP, 10x, 14x, PLM, there's SCP, there's bone marrow concentrate, and then there's platelet core plasma, just to give you an idea of all the things that we have. So we actually have 8 orthobiologics because our PLM, our 5x PLM is up here. So that just gives you an idea of how the range of what we can do. And you would need 8 different machines to make this, and even then it wouldn't be of this quality with what we can do in our lab. And that's the point I was trying to make earlier about what we can do in terms of quality here.